All right, so we're going to go ahead and get started. Thank you guys for joining our event. This event is centered mainly around reproductive and sexual health, and our speakers are going to be presenting about both what reproductive health is, what components make up reproductive health and sexual health, and why it's important for everyone to know about it, specifically college students. So we're going to put a link in the chat to a Jamboard. And that's basically just a way for y'all to anonymously ask questions. And you guys can just post them there, and then we will ask them to our event leaders. Will ask them at the end of their presentations.
All right, so I think right now we're going to move into a TED Talk. We're going to show like a little bit of a TED Talk that kind of explains some of the things about our topic of reproductive health. So we're just going to get that pulled up right now.
Yep, I'm going to share my screen.
All right, sweet.
Is that working? Can you hear that?
There is no more divisive word in our society today than abortion. Already, I've immediately made a number of you uncomfortable. You might be thinking, is she going to be political? Is this going to be a pro-life talk or pro-choice? Well, I'm going to put your mind at ease and let you know it is neither. Now, some of you might be thinking, but what else is there? Either pro-choice or pro-life. There are no other options, right? Well, that's the problem. And that's why I'm here today. But first, let me rewind and tell you how I got here. I was raised in an evangelical household and have been attending church my entire life. I wasn't really raised to be political in Australia, where I grew up, but when I moved to the United States in 2008 to further my television career, I joined a large conservative church in Los Angeles and quickly learned that politics was an important part of the evangelical world here. I didn't really hold any strong opinions on such a big topic like abortion, but if you had asked me then how I identified, I would have said pro-life. At that point, I had never met or spoken to anyone who had had an abortion. I didn't know any of the data or the research, and frankly, I wasn't interested. You see, it was easy for me to be distant enough from the topic, but hold fast to my views nevertheless. I ended up leaving that church after going through a divorce at the age of 29, and over the following years, my views on certain social issues started to change, and I would express these views publicly and online. The turning point for me on the topic of abortion came when I started to receive private messages on social media from church friends who I remained close with, telling me that they had had an abortion. Now, these are women who were very vocally pro-life, some of whom had even protested outside clinics, but those clinics were the first place they went to when they needed to get an abortion. One woman, who has given me permission to share her story, told me that when she was faced with an unplanned pregnancy, her first decision was to get an abortion, knowing that God would forgive her and she could move on with her life. I started to ask myself, why were these women going to the clinics they so strongly disagreed with? Was there more to their story than what the pro-life label with which they identified was offering them? And why did they feel comfortable talking to me only after I'd left the church? For most of my life, I thought I was pretty set in all my opinions, but learning about the women from my former church, I guess you could say it drew back the curtain for me a little and caused me to start asking more questions. So I decided to go on a journey and figure out once and for all what I thought about abortion. I started looking at the data and the research. I learned about the history of how abortion became such a lightning rod of an issue in modern American culture. I read about the impact of abortion policies here in the United States and around the world. But most importantly, I read and listened to people's individual stories, all of which were nuanced and complex. These were stories from women, but also men, transgender, and non-binary people. And these stories had the biggest impact on me. I've also spoken to many pro-choice women, some of whom have told me that they felt they also needed to be secretive about aspects of their abortion experience. One woman who has now written a book about her life told me she actually felt sad about her abortion, even though she knew it was the right decision, but felt she couldn't tell anyone that. It was becoming clear to me that there were women in both camps whose lives and experiences didn't neatly fit into any political or ideological category. You see, abortion doesn't happen in isolation. People don't just pick up one day, casually or out of the blue, just decide to get one. There are many factors that go into this decision. When I learned that 1 in 4 women in America will have an abortion before the age of 45, according to the Guttmacher Institute, and that the majority of women who get abortions in America are already mothers, roughly 60%, it completely changed the way I thought about abortion and the people who choose it. A study from Lifeway Research, a Christian resource, found that more than 4 in 10 women were churchgoers at the time they decided to end a pregnancy. In an article, they state, many women go silently from the church pew to the abortion clinic, convinced the church would rather gossip than help. Since 1990, data has also shown us that abortion rates have actually been in decline. But I wonder why there isn't more emphasis on the reasons for this decline in our policies and conversations. I have a feeling that once we start to do that, the binary pro-choice, pro-life labels will start to become more and more obsolete. So why am I doing all this research? Well, I personally have not had an abortion, but I have become very passionate about this topic after learning about the women from my former church, and now I want to use my personal background and professional experience to make a difference in the hearts and minds of other people.
So that should hopefully just kind of get everybody's minds on the topic a little bit.
Yep. So today I'm going to introduce our speakers. We have Dr. Jennifer Graham and Melissa Gerrior. They're from the Women's Center of Georgia College. We also have Dr. Scott Butler, who's a professor of public health here at Georgia College, and they'll be presenting their experiences and knowledge on the topics of reproductive and public health today. So if you want to give a round of applause on your little reaction thing down there, Dr. Scott or Dr. Butler is going to go ahead and get started with his.
All right, y'all. Well, thanks again for the welcome. Can everybody hear me okay? Okay, great. Well, I appreciate the invitation, and it's nice to see you all. I'm Dr. Butler. I'm a professor of public health here at Georgia College. I've been here since 2007, so almost 14 years. Boy, it's really hard to believe. I'm in public health, but I also teach courses that are cross-listed through the Women's Studies program. I'm a public health professional and sexologist by trade, and I was trained in both. I have a PhD in health promotion, disease prevention. I have 3 masters, one of which is in human sexuality. The other 2 are in health promotion. I studied at the Kinsey Institute and the Institute for Advanced Study of Human Sexuality. Here at Georgia College in the fall, I teach women's health, which actually has some openings in it for one. So if you're interested in a fall class and you want to learn more about reproductive health, that course covers a lot of the social context of things like reproductive health, things like abortion, and some of the policies that were alluded to in the TED Talk a minute ago. I also teach human sexuality in the spring and the summer. In the summer, it's online, so if you'd like to take that. And in the summer, I teach a course called Sex, Gender, and Sexology, which is about the social, cultural aspects of sexuality in the field of sexology. In the spring, I teach my own GC2Y called the AIDS Pandemic. I did want to plug before I forget that the Guttmacher, which was mentioned in the video, is a great resource if you're interested in reproductive health policy. That's probably the best. Another good one is called Advocates for Youth, which does a lot of reproductive health issues for folks of your age. And if you're interested in HIV/AIDS, AIDS Atlanta is good. Charles had sent me some things for me to talk about, and one of them is my contribution to reproductive health. Before I was a professor many moons ago, I managed a reproductive health clinic for college students. So I used to do HIV prevention, intimate partner violence prevention, contraceptive counseling. Basically, I worked 50 hours a week doing reproductive health, which was a really fun job. And then I went back to college to get my PhD to be a public health, sexual health scholar. I used to manage a peer education program at Georgia College centered on HIV/AIDS. And then the other thing I want to talk to you about is a little bit about my research. So a lot of my dedication to reproductive and sexual health right now has to do with teaching and research. And the research I do has a lot to do with college students and condom use. One of the things that I realized in my career very early is that college students, there weren't enough condoms given out to students. And we really didn't have any benchmark data to know how many condoms were being given out at colleges. And so I'm like, well, I'm gonna do a study on that. And I've done a few. The most recent one was 537 colleges around the country participating, representing about 5 million college students. And we found that 88% of colleges give out condoms to their students. So that was kind of interesting, almost all of them. However, there were certain groups that are more or less likely. For example, almost all the non-faith-based colleges give out condoms, where only about half of the faith-based, the religious schools. And the number of condoms given at the faith-based is much smaller than the non-faith-based. We also found that most colleges give out condoms through their health center. But when you start looking outside of their health center and their outreach, then it kind of dwindles down. There's a need to increase more innovative ways in which they give out condoms. Only about a third give out what we call female condoms, or sometimes called internal condoms, where most give out male or external condoms. And then the college health employees really believe that this is important. The college health folks believe giving out condoms to students obviously prevents unintended pregnancy and HIV, but it also enhances relationships. So there's this sort of added benefit. The big finding we had from this study is that on average, colleges only give out 1 condom per student per year. So it's like, here's your 1 condom at orientation, good luck, kind of thing. And no one had ever really thought about it in those contexts. So I started thinking, wow, what are some ways we can get to students that maybe if they don't go to the health center, or how can we increase that number? And after I published the first study, it was a very interesting experience because, one of the ways usually scholars are measured is they say, like, how many times are your journal articles referenced? Well, in mine for the condoms, not very much. Not very much. However, one time I got a call from a friend at UGA, and she said, we're not giving out enough condoms. And so what I did is I started calling everybody around the country and saying, what are you all doing at colleges? And apparently they all said, well, according to the Butler study, we're not giving out enough condoms. And my friend told me, I was like, wait a minute, that's me, I'm Butler. And I didn't know anybody other than at Georgia College where we're reading these studies, but apparently people were, including a colleague at Boston. And so at Boston, they decided we're going to create a mail order condom program. And UGA called Boston contacted me and they said, okay, we'll work together on a study. So we created a program called the Condom Ferry, which was an online mail order delivery program. In other words, you as a student can get online and say, I need 6 male external condoms, I need some lube, and I need some information. And in the mail, for free, a couple of days later, you would get those condoms and lube and information about where you could get tested for HIV, those kind of things, and also some information about consent. Well, we tracked the Condom Ferry program for 3 years, and we had 10,000 orders in the first 3 years. and we managed to get 733 college students to fill out a survey 30 days later after using the thing. And we gave out 47,000 male condoms, and we gave out 25,000 packs of lube and 1,400 female condoms. 2/3 of the participants in the study were women, which we thought was interesting. And 75% of the people who got the male condoms actually used them within 30 days. And the other 24% had intended to use the condoms. So that was pretty interesting because no one had ever asked that before about, what happens actually after you get the condoms, do students use them? Female condoms, only about 25% had used them, but 2/3 had intended to use them in the next 30 days. And most significantly, we found the students who used this condom fairy thing believed that it was far more convenient and more comfortable for them to get the condoms rather than going to a grocery store or going to the health center. And I think ideally, now this hasn't been done, I think ideally it would kind of be like Uber or Lyft, like you would pull out your phone and hit a thing, and there'd be like little condom drivers. Like, so if it's like 11 o'clock on Friday, you'd say, okay, I need condoms, and someone within 10 minutes would be at your door saying, here's the condoms for you. And then lastly, I just want to briefly talk before I pass it on to my colleagues. Our current study, which is, we've just finished collecting data, but we haven't analyzed it yet. But I'm the principal investigator of a study. There's 6 colleges around the country, and we're all collected data on student condom use. So we've got about 2,000 to 2,500 students. And I jokingly call it the kitchen sink study because any and everything I could think of about condoms is in this study. We're looking at, do students use condoms? Do they use latex dams? Do they use the internal versus external condoms? We're going to be doing gender comparisons. We're looking at condom embarrassment, condom self-efficacy, whether students have problems using the condoms, like putting them on incorrectly, and are they supportive of colleges giving out condoms to their students? And then most interestingly, I think we're looking at this condom stealthing thing, which is non-consensual condom removal, which up until a few years ago, I hadn't really thought about too much, but there are people, believe it or not, that are sneakingly removing the condom off during sex and not telling their partner, like it's too dark or what have you. And we're measuring that, and we're also asking people whether they think that's, kind of a form of assault or whether that's non-consensual. So hopefully a year from now, we'll have that study published as well. All right, so I'm going to pass on to the next panelist. Dr. Graham, are you going next?
Me? Sounds good. So hi, everybody. My name is Dr. Jennifer Graham. I work as the director of the Women's Center and LGBTQ plus programs. So I'm not a faculty member. I do not have a long list of degrees around sexual health the same way that Dr. Butler does, but we in the Women's Center and LGBTQ plus programs offer a lot of some of those programs, right? So we have things like free condoms available in the center. We have dental dams available. We have both internal and external condoms available, as well as some latex-free ones. So we're one of those kind of places that Dr. Butler was talking about on campus where folks can get those resources as well as some of that education on campus. And as I was thinking about kind of what are some of the things that I could talk with folks about, but I have some, I don't know if expertise is the right word, but some experience in talking with students about, and that we get a lot of questions in the center about, is around birth control options. That is something that we every year have people come and ask us, where do I go? How do I have this conversation? How do I talk to my partner about this? How do I talk to my doctor about this? And so I wanted to just spend a few minutes talking about those different birth control options, because there's a lot of options. And I think sometimes folks think that there's just like the pill, right? Or there's only external condoms. And there's a lot more options. There's more options, I think, now than we probably ever had before regarding birth control. And so just really quickly, I do have a quick graphic to show you all. So let me get it pulled up. This is not my graphic, but it is a nice kind of overview. So I'm going to say thank you to the University of San Francisco, because it's their graphic. So this kind of graph shows both how well do different methods of birth control work, as well as what are some of those options, right? So when we talk about what kind of methods are really, really super effective, right? So less than a 1 in 100 chance of getting pregnant when you use one of these forms of birth control. They're typically long-acting forms of birth control. So things like the implant, so that is something that typically gets implanted in the arm. There's different types of IUDs. So there are hormonal IUDs, such as the Mirena or Skyla. And then there's a copper IUD. IUD stands for intrauterine device. So that is a small, they're usually about yay-ish big device that gets inserted into the uterus. So you have to go to the doctor for that. Same thing with an implant. Obviously that gets implanted into the arm. And so you also have to go to the doctor for that. And then there's sterilization. So that can be either male sterilization, a vasectomy, or it can be female sterilization, typically done through a tubal ligation. So those methods of birth control are the most effective. They're long lasting. Typically go to the doctor, you know, for an implant or a type of IUD. You go to the doctor once and then you're good for usually 5 to, like it says, 12 years, depending on the type of birth control that is. Both implant and IUDs are hormonal, so they have different types of hormones in them that kind of regulate the ability for implantation and some things like that to occur. And then the copper IUD does not have hormones, but again, affects the lining of the uterus, making implantation more difficult is how IUDs often work, as well as for the hormonal types, also hormonal. So that's those ones that work really, really well. Then we have the ones that work pretty well. So around 6 to 9 people are going to get pregnant, depending on the method and how consistently they use that form of birth control, right? So we've got the pill, got to take that every day. Some pills you have to take it at the same time every day. There's the patch, so that gets worn kind of wherever on the body. It's a hormonal birth control as well. And then the ring, sometimes called NuvaRing, and then there's a shot, which is not quite, you know, you go get that every 3 months, still have to go to the doctor for that. The pill and the patch and the ring are all, you get a prescription and you get that filled, and then you change, you know, with the pill, you got to take that every day. With the patch, you change that out once a week, and then the NuvaRing or ring, you typically are going to change that out once a month, but they're all going to require a prescription, so you've got to go to a doctor to get that prescription, make sure things are well, there's no contraindications, anything like that. So those, if they are used well, right, the right way, so if we're talking about the pill, that you don't miss any pills, that you take your pill if you need to take it at the same time every day, that is taken at the same time every day, those work pretty well, right? And so then we have methods that maybe don't work so well by themselves or at all. So the pull-out method or withdrawal method, that's not real effective. You know, semen can be in pre-ejaculation fluid. And so even if a male does not ejaculate into someone, the pregnancy can still occur. Not to mention risks of sexually transmitted infections, right? So fertility awareness is where you track kind of, there's lots of different things. So you can track your temperature, you can track secretions from the vagina, some of those sorts of things to kind of see how, you know, when am I likely to ovulate, and then avoid sex during that likely period of ovulation. As you could maybe guess, it's not also the most effective means of birth control, also does not protect against STIs. And then we have internal condoms and external condoms, so sometimes called male or female condoms. These methods, when used correctly, can be really effective. They also protect against STIs. So when we're talking about how can we make sure that we're preventing pregnancy and preventing STIs, a really great method is to pair up one of the types of condoms with kind of any of the other forms of hormonal birth control. That's going to get you kind of the best protection both from pregnancy and from STIs. You'll have heard me mention that it's for a lot of these that you have to talk with a doctor, right? And there's also some other forms of birth control, such as a diaphragm or a sponge. Diaphragms also you're going to need to see a doctor for. You can use spermicide. So sometimes condoms will have spermicide on them, sometimes they won't. Those can also be irritating to folks sometimes, so that's a good thing to know. But you will have heard me talk about, for a lot of these, needing to see a doctor. And I think it's really important to acknowledge that I am not a doctor. So don't take any of the things that I said as medical advice, because I can't give that. But it is important to go to a doctor. And when we're talking about sexual health generally, for somebody who's sexually active, or even if you're not sexually active, but you're, are a college age and above, it's important to go get checked out at the doctor, to have an annual exam. Whether that's testing for different STIs, talking about birth control options, for people who menstruate, talking about periods, and if they're painful, if they cause lots of cramps or different things like that, there are different options and things that are available to people. But you've got to go to a doctor and talk about those things. And so it's really important to find a physician that you feel comfortable talking with, that you can have those kind of open and honest conversations around your birth control needs, conversations around menstruation and different things like that. There's lots of different things that can happen within someone's reproductive tract who has a uterus, who has ovaries. There can be fibroids, there can be lots of things that happen. And so it's important to have a doctor so that you can get that annual exam and have those conversations. And your doctor is really going to be the best person to talk about what are your needs with birth control. Can you remember to take a pill every single day? Can you remember to change out the patch? Or do you want a more longer term hassle-free option for birth control? So those are some really important things to talk about. Dr. Butler mentioned consent and talking about stealthing and some of those sorts of things. It's also really important if you're going to have sex with somebody to talk about birth control as part of that consent conversation, so that both partners know, we should be talking about that in regards to sexually transmitted infections and what our risks are and some of those sorts of things with consent. But also be talking about, for folks who could potentially get pregnant from sex, are they on birth control? Do the partners both want to be on birth control, or is that couple trying to have a baby, right? So having those conversations and having that be open to conversation. So the other thing that we could briefly talk about is emergency birth control. And so that is, here we go, here's some types of emergency contraception. Sometimes condoms break, or sometimes you have sex and you realize it was unprotected. We may have missed a birth control pill or forgot to change out, that ring or change the patch or whatever happened, right? And we're worried that unprotected sex may have happened. So there are a number of different emergency contraceptives that can be used. Plan B is often what folks think of as emergency contraceptive. So both Plan B and Ella are medications that you can take. Plan B is now available over the counter, so you can go into a place like CVS or Walgreens and ask the pharmacist for that. It's typically behind the counter, but you don't need a prescription for it. And so that is a good thing. It's quickly available, right? Usually cost around $40 to $50, depending on what store you get from. Ella, you do need to get from a healthcare provider. And then an IUD, a copper IUD or an IUD is the most effective, right? Again, it works at the uterine level. It makes some changes within the uterine lining to prevent implantation from happening. So that is one of the reasons why it's super effective. Both Ella and Plan B are hormonal emergency contraceptives. Something important to note with both of those, though, is that both Ella and Plan B become less effective if the person who's taking them is over a certain weight. And they're also, all of these are only effective within a certain number of days. And so time is of the essence for these. If emergency contraceptives is needed, you want to get that taken care of as quickly as possible. So those are some quick little things about birth control. I am going to stop sharing and pass things over to Melissa.
Super. So Dr. Butler and Jen talked about the kind of like physical side of things, some prevention sort of stuff around reproductive health. I'm going to talk more about the emotional and like preparation side and talk about sex ed. So I'll introduce myself first. I'm Melissa Gerrior. I work here as a program coordinator in the Women's Center and with LGBTQ+ programs. I've been at Georgia College for almost 7 years. And I do a lot of conversations with Project Brave, so our sexual violence prevention education initiative on campus, but also do a good bit of just like sex ed kind of stuff. I have a certification through the Our Whole Lives program to, do kind of college age level sex education. And it's just something that I really like, want students to feel empowered about because that's, at the end of the day, like if you're choosing to have sex, like you should be having sex that works for you, right? And it should be something that you are, interested in and is, fun and enthusiastically consented to and all of those things. So let's chat a little bit about how to get to that. So first, kind of like Jen was saying, making sure that you know your body, right? Some of that can come with going to the doctor, getting tested regularly. If you are somebody that's actively having sex, it's a good idea to get tested about once a year at least. And if you have sex with like multiple partners, then probably closer to like every 3 to 6 months, just making sure that things are okay, that you're not, unknowingly passing along an STI, that sort of thing. So knowing all of that, but also like knowing your body, right? If you are like knowing what is comfortable for you, right? What kinds of things turn you on, right? Like what kind of stuff you want to participate in. And also knowing yourself like mentally and emotionally, right? Like, so what am I willing to engage in, right? Like what kind of sexual acts am I, think are great? What am I maybe curious about? What do I think is not so great? Who am I willing to do that with, right? Am I willing to do like, am I willing to have oral sex with somebody that maybe I just met downtown versus like, I'm willing to have oral sex with somebody that's I'm in a long-term relationship with, right? So kind of there's those pieces to different sex acts of like making sure just like what your boundaries are, right? That's kind of what it comes down to. And so I'm going to share a link in the chat, but I'll also share my screen. And this is just a really great handout that we like to highlight here at the center to kind of start thinking about some of these conversations. You can fill it out by yourself. It can be a really like helpful tool, but also, if you have a partner, it can be a thing that you do with them. And it can really start some of those conversations because consent should be a continuous conversation, right? The things that we are into, that we're not into, etc. So to go quickly kind of through this, it has all of these different things, okay? So things that I want to do, right? And then it breaks it down into like, I'm good at giving or receiving these different acts, okay? So just kind of going through it, thinking about it, right? What works for you, okay? Keeps going through more, so lots of different things to consider, right? Then it gets into this really good section here, a few things about toys and lube. So It's important to have conversations around allergies, right? Especially if you are using condoms, lubricant. Some folks have latex allergies, right? There's some correlation. If you don't know if you are allergic to latex, there's sometimes a correlation between allergies to like strawberries. There's a little bit higher of like an incidence of if you have a strawberry allergy, then you might be allergic to latex. So just kind of knowing those things about yourself, okay? And then of course, like talking about the things that are hard lines for you, right? Absolutely do not use this near me, okay? Here's a thing to talk about, like turn-ons. And then talking about language, right? What we're gonna say, okay? So how do you wanna be referred to when it comes to your gender? If someone's gonna talk about your genitals, like what words are you comfortable having used or to like talk about those things, okay? Some people have words that are like, absolutely not, do not use that to refer to either my gender or my genitals, okay? Some things like safe words, right? So this idea of if, you know, we're in the middle of doing something and somebody drops this word, then it's like, okay, everything's gonna stop and we're gonna check in and make sure everything's okay, right? So when I want you to stop, here are some signs that like what you're doing is great, keep going, okay? All of those things. Talking a little bit about fantasies, right? People have them, so if you want to talk about them with a partner, that's great. And then talking, it's called Draw the Lines. And it's really a boundaries thing. So like, what are the things that are hard lines for you, right? Like, what do you need to happen to feel safe and comfortable within the context of this sexual relationship? Okay. And then it has just a fun, if you are filling this out with somebody else, has a fun Venn diagram, right? Who doesn't like a Venn diagram? So putting down the things that the other person's into and the things I'm into, and then seeing what is in the middle, right? Because that's really what it should be about, is that all parties involved are having a good time and a consensual time, and getting out of that interaction what they're looking to get out of it, right? It's a two-way, multiple way street, okay? That everybody just needs to be on the same page for, okay? So that's really what I had. Yeah, so we can move to questions if that works for folks.
All right, so now we're gonna take a look at the Jamboard. And if you wanna keep adding questions, you can. And I'm just gonna go ahead and pick a few for our speakers off of that. And anyone's welcome to answer. Some might be particular to whether it's either or, but I'll just read them so far. Okay, we can just start off with a broad question. What are some issues in today's world regarding reproductive health? So anyone can take that one.
I can start.
Okay.
Yeah. So I think beyond the obvious things that we've talked about, right? Like sexual health, making sure that you're getting tested, making sure that you are communicating your status to a potential partner, kind of all of those things that we think about, the stuff that was mentioned in the video to begin with. It's also really important to expand reproductive health and the idea that it is really about like the access to family and to safety for a lot of people, right? So what does it look like for a queer couple to be able to either have a child through IVF, to adopt a child, things like that? What does it look like for like Black women to be able to raise their children in a safe and secure way, right? There are all of those issues that also go into reproductive health and reproductive justice. So that's what I would start with.
I want to jump in and piggyback off of where Melissa started with that, and also mention things like maternal death rates and infant mortality rates. you may have heard recently in the news over the last, this is not a new trend by any means, but Black women have the highest, mortality rate post-birth. It's really high. It doesn't need to be. There's a lot of reasons that's happening, and they're all tied to systemic racism. And those things go hand in hand. So when we're talking about people being able to have children in the way they want, and be able to raise those children in healthy and safe environments, like Melissa said, those are all parts of reproductive justice that I think, like Melissa said, don't get talked about enough, but talking about those linkages between reproductive justice and things like systemic racism as well, I think are important issues that we should be talking about more.
I was going to mention the maternal health too. That's definitely a big one in Georgia for sure, as is access to care in general. If you were to look at the state of Georgia and where all the providers are at for reproductive health, it's very difficult. Once you get to outside of Atlanta, it's difficult to find providers. That becomes a big issue. I think a big part of our problem is the abstinence-only education. And there's a lot of research. We spent $2 billion on this as a culture over the last few decades. And it just doesn't work. I mean, there's all kinds of research saying it's ineffective. And I think, just being personally honest, I think abstinence-only education is bad for people who want to abstain. It's not just not effective. I think that's at the root of a lot of our problems. Policy is a big thing right now. So for many, many years, 50 years, we had what's called Title X, which is using government funds for reproductive health clinics, a big network between that and Medicaid for reimbursing contraceptives. Very, very effective policy that helped prevent 800,000 abortions a year. And that policy has been attempted to be undercut the last 2 years. And then abortion is a big thing. Whether Roe v. Wade is still stands, and and you may have very strong opinions whether you're pro-life, pro-choice, or in between. But undeniably, I can't mention that's not a big thing right now, because I think it is with changes in the Supreme Court and that kind of issue.
All right, thank you for answering that one first question. And the next question is, just for the Women's Center, do y'all do any kind of therapy for sexual assault victims, or should that go to the Counseling Center?
That's a great question. So Counseling Center is the confidential resource on campus for folks. So if somebody is wanting therapy, to talk with someone confidentially about a sexual assault that may have occurred, Counseling Services is absolutely the best place to go on campus. Off campus, we have a new sexual assault center called the Bright House that's located here in Milledgeville. And so they are also able to offer services to folks who have experienced a sexual assault, including things like medical forensic exams. They have a counselor on staff there as well as advocacy. So that's being with somebody, helping them know their resources, all of those sorts of things. A student could absolutely still come to the Women's Center, but it's not going to be confidential. So what that means is we would absolutely help you, provide support to you, all of those things, but we would be mandated to report that incident to our Title IX coordinator on campus. So if somebody would still rather come to us, that's fine. You can come see us. We'll be happy to help you. We just want to make sure that folks know that we would need to let our Title IX office know on campus about that.
Same thing with professors as well. It's not that, like, if you want to come and say to me or something like that you've been assaulted, that's fine, but I have to report it to the Title IX coordinator, and then the coordinator follows up to help you. So as Dr. Graham was saying, the Counseling Center are the ones that have a different level of policy on that, but they don't have to report it.
We have in the past had things like support group and coordination with the Counseling Center. That may be something that we do again in the future. We'll see. We'll just have to see on that. This year we haven't had anything like that because a lot of things have been remote and it just maybe doesn't work so well in that way. But, you know, counseling services absolutely is a good place to go.
All right, and now I have a question for Dr. Butler. My question for Dr. Butler is concerning your research regarding public pubic hair removal. What are some of the health risks that come along with this type of grooming?
Oh, yeah, great question. So yeah, in 2015, we published a study on pubic hair removal practices among college students. And we had about 1,100 students from Georgia College and Indiana University in Bloomington. We partnered with the Center for Sexual Health Promotion over there. And we found that most students had groomed their pubic hair in some way, like 95% in the last month. Now, it'd be interesting to review the study because I'm not sure if those trends have changed or not. But you had women were more likely to remove all their pubic hair. And then you had some that would trim, and then a small percentage who left it sort of natural, what have you. And same thing with the men, although the men were less likely to remove all their pubic hair, a lot of them trimmed, and then a few percent did nothing. One of the interesting things we measured was, do you have any sort of problems associated? Are there any symptoms or problems? And the most common one was like genital itching was the most common one. About 15% had like genital pain associated with it, or a small percent had cuts associated. So you kind of want to be careful and make sure that you're knowing what you're doing. Most students were using a razor and not like getting permanent removal like electrolysis or anything like that. However, most of the people who had the problems they weren't severe enough to have to see a doctor or nurse or healthcare provider. But you do want to be conscious about it and make sure that if you are removing your pubic hair, then you're conscious of it and don't hurt yourself. And some people think that you may increase risk for like STIs, like if you just remove your pubic hair and then you have sex with someone. Some people think it may increase it maybe easier for like HPV or herpes to get inside the body. We're not quite sure on that. There's been a correlational study, and so, but that would suggest maybe you need to wait, like in between having sex, if you think you're at risk after you remove, so the skin heals over a little bit. But yeah, if you're interested in that study, send me an email. I'll send you a copy.
Thank you for answering that. And someone who's in the class asked a question, and it was kind of answered in the group chat, but I feel like it's an important question, a lot of questions people might have, and I think just Natalie was the one to ask it. So she asked, does it matter if it was between just two students or a student in a profession or a student and a professor for being reported, or are they all reported either way? And yeah, anyone can answer that. It was kind of answered in the chat, but if you guys want to just elaborate on that, just because I feel like that's a common question people have, and it's something that we have heard about before.
Yeah, sure. So anytime a student lets an employee, so whether that's us in the Women's Center, any other faculty or staff member, know about an incident of either sexual assault, of dating or domestic violence or stalking or sexual harassment, then we as employees of the institution have an obligation to pass that, a limited amount of information on to the Title IX coordinator on campus. That's, if that incident is between two students, whether that incident was between a student and a faculty or staff member, whether that was between a student and a graduate or a teaching assistant, or whether even if it was between a student and a non-student, right? So if a student comes and tells us about something, then we've got to pass on information like the student who told us about that incident. We have to pass their name on to our Title IX coordinator, as well as like what generally, right? So was it that they told us about a sexual assault? Was it that they told us about an incident of sexual harassment? Generally, like what was the incident that they told us about? And then if there are any other pertinent details, right? So the name of the person who maybe assaulted them or harassed them. If the person knows their name and they share that with us, then we would need to pass that on to the Title IX coordinator too. And then to give people a little bit of information about like what happens then. So once the Title IX office has that report, then our Title IX coordinator reaches out to that person to say, hey, we got a report filed about this thing that you told, let's just say you told Jennifer about it. And I wanted to follow up with you about that. So, would you be willing to come in and talk with me about this incident? Would you like to pursue, what we call an administrative investigation on campus, that sort of thing. So, and the Title IX coordinator would tell them what their different options are, kind of what those different paths could look like, answer any questions for a student. Yeah, so, and then, but that doesn't mean that we couldn't then also help that student with other resources, right? So, and get them more information. So I hope that that helps to address that question. It's a really good question and it's an important one. So thank you all for asking.
I also just really want to quickly add that for Georgia College, our sexual misconduct policy is university system wide. Okay, so when we're looking at if an incident was between a student at Georgia College and a student at like UGA or Georgia Southern or any public school within our system, they're held to the same standard. So they would fall under the same kind of misconduct policy, and that could be brought up at their institution.
All right. And I want to ask a question that I feel like a lot of students could connect to, and it's for any speaker. What do you think are ways that students / Georgia College can make this campus a more sex positive or where education plays?
I wish we had more classes. I think we actually do a good job, believe it or not, because Georgia College has a lot of women's studies classes that are just amazing. There's a huge assortment of them offered in the fall. But I really wish that, I think I could just teach the one human sexuality class, and if we had like a handful of people just teaching that, like if that was in the core or something like that, somehow, some way, I on Facebook every now and again, I say, what would the world be like if everybody had just a general human sexuality class? I do wonder, like, if the world would be a better place. And I think if we could somehow increase access to those who just want to take it as an elective, like right now you can take it as elective in the summer, but I don't think a lot of people know that. So that's why I always lead with that, because in the summer. But I think having more education, I think is good. I think more courses, more professionals, like, doing more outreach from students, I think from my end, that's what I see. But I do want to give Georgia College credit for a lot of the good things that they do, because they were very supportive of me creating new classes. And the academic freedom is very good here in terms of the types of research. Like, no administrator has ever challenged me on the type of research that I do, which is just amazing. Like, anytime you have a sex researcher, there's always an administrator behind the scenes supporting that person. Otherwise, they wouldn't be able to do that. And many years ago, this is way before you all were here, there were some rumbles about legislators trying to go after some researchers, and it happened at UGA. And immediately at Georgia College, the former president, who was a feminist, actually stood up and said, we're going to be supportive of these courses. So that's what they were doing.
So I completely agree, more education. And I also want to back that up a few years, right? So like, yeah, I think it would be fabulous if we were able to offer every student on campus, like, be cool to do that during, right? Like have some sex ed sessions during orientation or week of welcome or first year seminar or something like that. But I think even backing that up more, right? We know people don't just all of a sudden become sexually active when they get to college. That starts earlier. And so I think a way to to make our campus more positive, make it a better and more positive environment for conversations about sex, is if we start having those conversations with people earlier, right? So if we normalize talking about sexual education and reproductive health back into middle school, high school, elementary school even, right, in age appropriate ways, and start those conversations earlier, then I think we'll be in a place as a whole society, right? Like not just Georgia College, but our whole society, where these conversations are just much more normal and acceptable, and people don't get embarrassed to ask questions about their bodies or about sex or those sorts of things. So I think that's what I think.
And I'm also going to just plug our the events that we do at the center. We have a number of like sex ed events that happen pretty regularly, and we're also working on a video library so folks can access them from the comfort of their own space, to try and bridge some of that education. Okay, thanks, Jesse. We enjoyed that event too. It's fun.
So with us closing in on about an hour here, I just want to say thank you to all of our speakers. We all really appreciate you spending your time with us. And I think we all learned a good bit here.
Thanks for having us.
Yeah.
Yeah, thanks for having us anytime. Feel free to reach out to us.
Yep, absolutely. If you have any questions, feel free.
Thank you, guys.
You're welcome.